Hello, friends. Dr. Tabor here, chiropractor, educator, and executive producer of the documentary A Better Way. Welcome back to part two of our series on degenerative disc disease. And today we're going to cover what causes degenerative disc disease and how can you treat it if you already have it, and even more importantly, how can you prevent it from ever happening in the first place. I'm also going to talk a little bit about how you can reverse it. And a lot of people kind of, their mouth opens wide when I say reverse degenerative disc disease. And you know what? If you're in phase 2 or phase 3, like you're seeing on your screen there, yeah, your spine will never go all the way back to normal. But there is some reversal that you can get to the spine. I've seen it over the last 15 years of practice. When we start really improving the health of someone's spine and nervous system, we can get some reversal in through this process. And let me explain that and show you exactly what's going on. So first, we've got to know what causes something in order to understand how to reverse it or even how to prevent it, right? And have you ever heard of the phrase, the cause is the cure? Well, that certainly applies here. It applies in a lot of different areas. For example, dentistry. Think about it. We know that sugar and bacteria cause cavities. Therefore, since we know what causes cavities, we know that if we brush the sugar and the bacteria off our teeth, maybe floss it out of our gums on a daily basis, then we could reduce our risk for cavities. We could literally prevent cavities by taking care of the teeth, by reducing the cause of what causes them. Now, I think it's important to note that if you already have a cavity present, you can't simply brush it out, right? We must go to a dentist who's trained to detect and correct cavities to have it corrected, to somewhat reversed, right? I think that's true in even degenerative disc disease. Sometimes if it's already there and it's significant, we've got to go to a professional to have it at least corrected or reversed as much as possible, to get some therapy on that, to make sure that we're improving the health and function of our spine. And then there are some responsibilities that we can do at home, just like brushing and flossing, but we can do for our spine to help maintain the improvement we got at the professional, and then also prevent any further deterioration. So what causes degenerative disc disease? And you'll hear me refer to it as DDD. That's how just a quick initials, right? Okay, so we must know what causes this in order to reverse it. So what causes it? Most people think that age and genetics cause degenerative disc disease. Not true. And I'm going to prove it to you here. And I'll try to go quickly through this, but I'm going to prove to you that age and genetics is not the cause of spinal degeneration. Now, when we think spinal degeneration, there's a lot of facets and a lot of different things that go into spinal degeneration or degenerative disc disease. But let's think bone spurs and loss of disc height. So you're seeing that picture right there is a picture of a vertebrae, two vertebrae on top of each other, and between each vertebrae is a disc, a spinal disc. Now, in degenerative disc disease, two main things we see are loss of that disc height and the bone spurs that begin to grow there, right? So that's what we're talking about when we say degenerative disc disease. Now, does age cause degenerative disc disease? I can't tell you how many people who come in my office and they're like, "Oh yeah, that's normal for me. I'm 60 years old, or whatever." Age does not cause degenerative disc disease. Let me prove this to you. How old are the vertebrae in this x-ray? Now, I put a picture there. This is not the same person as the person in the x-ray, but I wanted to kind of show you how this person is standing when they took the film so you understand what we're looking at on the x-ray. So on the x-ray, the person is faced to the right side of your screen. The back of their head is on the top left. You can even see a piece of their jaw on the top right. And so you can see that that's how that person was standing when we took that x-ray. Now I want you to look closely, lean into that x-ray. And I want you to see where we have those red arrows pointed at the disc spaces. You see that the two discs in the upper part of that x-ray are normal. They're nice and open. You see that the three discs in the bottom part of that x-ray that are labeled degenerated, those discs are narrowed and there's already beginning stages of bone spurring that are happening there. Those three discs have disc degeneration. If disc degeneration was caused by age, how old are those discs in the upper neck and how old are those discs in the lower? They're the same age. So degenerative disc disease cannot be caused by age. That would be impossible because those two discs are the same age. Obviously, age doesn't cause it. It's caused by something else. Now, the reason it's correlated with age is because once that thing that causes it is there, time plays a factor. So the longer that issue is there in the joint, then the more degenerative it could get. That's why it's correlated with age. I hope that makes sense. Now, the second question I got to debunk and show you here is degenerative disc disease caused by your genetics? Now, I will tell you that genetics does play somewhat of a role, okay? I'm not going to deny that, but it does not cause degeneration, and you are not slave to your genetics. In fact, let me share some studies with you here. Now, this was called the Twin Spine Study. It was published in Spine Magazine, or Spine, the Journal of Spine, which is the most prestigious journal in the world when it comes to spinal care and health. And so in this study, they followed a bunch of identical twins, right? Same genetics, and then they would analyze their spine for levels of disc degeneration. Now, they actually showed that 61% of the time there was a correlation between disc degeneration and genetics. Okay, so you say, well, that's a pretty big number, right? 61% of the time, your degeneration could correlate with your genetics, all right? And now, there was another study that was kind of a rebuttal for that twin study here. This study was published in the New Zealand Medical Journal, and it said, look, when they did that twin study, they just looked at twins and they just looked at their spines. They didn't take anything else into consideration. They didn't take what we call epigenetics into consideration, that your environment could play a role in how your genes are expressed. For example, if I have the gene for degenerative disc disease and I get adjusted regularly and I take care of my spine and I do my spinal hygiene exercises and I stay fit and strong, then I might have less degeneration than someone else who has the same genes. Versus what if I just neglect my spine? I just sit in front of a computer all day long. I stare at my phone for hours at a time. I am overweight or obese. All these things that contribute to the degeneration of my spine. I would have worse degeneration depending on, even besides my genetics. I hope that makes sense. So that 61% of the time, that 61% we should take with a grain of salt doesn't always mean your genetics play a role 61% of the time. But even, let's just say this. Let's say yes, 60%, 61% of the time, your genetics are correlated with your disc degeneration. Check this out. This was an article published on the CNN website that said, bad teeth? Blame your genes. Watch this. Scientists say that the health of your teeth depend on a combination of genetics and dental hygiene. And I'm going to go on. Watch this. About 60% of the risk for tooth decay appears to be due to genetic factors, says Marielle Marenza, director of the Center for Craniofacial Dental Genetics at the University of Pittsburgh School of Dental Medicine. I'm going to say that again. About 60% of the risk for tooth decay appears to be due to genetic factors. So they're seeing this even in tooth decay. Does that mean that you should stop brushing your teeth because 60% of your cavities are due to your genetics? Does that mean that you should stop going for checkups to a dentist or getting your teeth cleaned? Because you already have 60% of the time your cavities are genetic. No, in fact, what it's saying is that top line there. Scientists say that the health of your teeth depend on a combination of genetics and dental hygiene. So that's exactly what I'm saying. That the health of your spine depends on a combination of genetics maybe and how well you take care of it. Okay, so I'm not saying genetics has nothing to do with spinal degeneration, but I am saying it does depend. You have a very, very large factor that plays in with what you do and how you take care of your spine. All right, so back to this. What causes disc degeneration? Well, we know for a fact, this is not debatable, that those two things that are involved with disc degeneration, bone spurs and loss of disc height, we know what causes those things. Bone spurs, a law that was, and I'll go over this in just a second, that was a German anatomist actually came up with called Wolff's Law, causes bone spurs. We know that. Loss of disc height, we know that a lack of imbibition causes loss of disc height. Let me go into each one of those real quick. Wolff's Law, it causes bone spurs. How does it do that? Okay, so a German anatomist and surgeon, Julius Wolff, in the 19th century states that bone in a healthy person or animal will adapt to the loads under which it is placed. If loading on a particular bone increases, the bone will remodel itself over time to become stronger to resist that sort of loading. Okay, I'm not going to go on and read the rest of that there because we already covered it. That's what causes bone spurs. If you have abnormal pressure or abnormal stress on areas of your bone, excuse me, the abnormal areas or the stress that is on that bone will cause that bone to remodel and strengthen. And that's what your body's trying to do when it forms a bone spur. It has stress there. And so it's trying to strengthen the area by laying down calcium. Okay, so Wolff's Law causes bone spurs. We know this. Now, what causes loss of disc height? This is a term called imbibition, the act of imbibing, especially the taking up of fluid by a colloidal system resulting in swelling. Okay, this process is taken advantage of during the adjustments that you get, the chiropractic adjustments, and also sometimes decompression therapy of the spine. A pressure gradient is created and diffusion of fluids into the disc occurs. This process also happens to a small extent during movement of our disc, and this is very, very important. Check this out. After puberty, so after a child goes through puberty, blood flow to the disc decreases. The health of the disc, right? The health of the disc means nutrients in, waste materials out. Nutrients in, waste materials out. That process depends largely on this term called imbibition or moving or pumping of the disc. So after puberty, if we don't have that blood flow that's coming to those discs and we have to sit for hours and hours and hours, or we're on cell phones or we're in front of computers or we have poor posture and we're not getting that nutrients in, waste materials out that is necessary from an imbibition or moving of that disc, it slowly begins to degenerate. And you can see from this image here on the right of your screen that we have a normal disc. Well, that disc stops moving and it starts to degenerate, and those ligaments around the disc that's holding in the gel material from the what we call the nucleus pulposus, the gel material inside the disc, is that ligament around it is holding it in. Well, now it's degenerating, and so it begins to let some of that gel out, and we have disc bulging. You've probably heard of that. Or we have herniated disc. You've probably heard of that. A lot of people don't realize that's part of a degenerative process. I mean, sure, sometimes in a car accident or you fall off the roof, an injury could cause those things. But you know, in my office, 80 to 90% of the time, a disc bulge and disc herniation is not caused by an injury. It's caused by this degenerative process because we're not really taking care of our spine. And then the disc begins to thin. And then see that on the bottom right where it says disc degeneration with osteophyte formation? Osteophytes are bone spurs. So now the disc has narrowed and we have extra stress on that joint. So the body's laying down calcium to grow it together with using bone spurs. All right. So now that you know what causes bone spurs and loss of disc height, okay, or degenerative disc disease, now what can you do to prevent and treat if you already have it, and then even reverse it as much as possible? What could we do? Well, we must reduce the stress on the bone, first of all, by maintaining good alignment. Okay, so when your spine is out of alignment, one area is going to have more stress than another area. Does that make sense? If your spine's made to be in a good alignment, it's made to distribute that stress evenly. When we have a misalignment, it distributes that stress in certain areas more than others, which causes bone spurs, causes calcium. So we have to reduce the stress on the bone by maintaining a good alignment, and we have to increase imbibition by moving the joint. Reduce stress by maintaining good alignment, increase imbibition by moving the joint. So we always say you must address 3 areas of spinal health. And these are the 3 areas of spinal health you need to know and teach to your family: alignment, motion, and strength. If you focus on those 3 things, you can improve the health of your spine, you can prevent degeneration, you can help improve how you feel if you already do have this degeneration, and you can help reverse it as much as possible. Alignment, motion, and strength. And how do you do that? How do you properly take care of your spine? Well, you're going to recognize this poster if you've ever been in our office. We always tell people to do these 2 things. Number 1, regular chiropractic visits. Okay, now talk to your chiropractor what regular means. See one of our last videos that we just did on how often you should be going to the chiropractor. But it's important. Remember the first thing I said when we started this was like the first or second slide. Sometimes if you already have a cavity, you can't brush that cavity out. You need help. You have to go to the dentist to get that cavity corrected as much as possible, and then you can go back to brushing and flossing and preventing cavities. Same thing when it comes to your spine. If you already have disc degeneration, if you already have, subluxation or an issue with your spine, sometimes you need professional help to help reduce that, to help correct that as much as possible. And then you can start doing these exercises on a regular basis, because that's the other part of it. Regular chiropractic visits and daily spinal hygiene exercises. And these are our spinal hygiene exercises that we recommend: the range of motion stretch, the resistance band, the wobble disc exercise, and spinal molding. And here's why we do each one of those exercises every day. We do the range of motion stretch because, remember, we want to improve imbibition. We want to improve movement of the disc. That helps move the joints. We want to lay on our spinal molding rolls in the evening while we're in bed, right? Because we're already relaxed. We can mold the alignment of our spine. We should have good curve in the neck, a good curve in the lower back. So we are maintaining our alignment between our chiropractic adjustments by doing just those two things. If you just did those two exercises every day, it would help you maintain the health of your spine. Range of motion stretch, spinal molding. Do that every day. Now we could add these last two exercises and prevent some of the most degenerative postures in the world. We could add the resistance band exercise, where you put that on the back of the head, you strengthen the muscles in the back of your neck. Why? Look around. The most degenerative posture in the world is head forward posture. You see these people and their heads sticking out 2 or 3 inches in front of them. That is causing degeneration in their neck at such a fast rate. It's going to grow bone spurs. It's going to cause loss of disc height. It's not good, right? So we want to maintain good, healthy posture by strengthening the muscles in the upper back and neck. And then the last one there, the wobble disc exercise, that helps promote imbibition in the lumbar spine. Those discs in your lower back need to be nice and hydrated, and you need a lot of movement and motion. And a lot of people are sitting at a desk for so long, they don't get that movement in the discs in their lumbar spine. So if they use a wobble disc and they start to move that lumbar spine, they're flushing fluid in, remember, nutrients in, waste materials out. Helps keep those discs healthy. How can you learn more about our spinal hygiene products? Well, you can check them out in our office anytime, or you can check out spinalhygieneproducts.com. That's one of my websites, and we do ship these products all over the world. So spinalhygieneproducts.com. And let me invite you into our office if you're in the Northwest Houston area. If you're not already a patient, we'd love to have you come in and get your spine and nervous system checked. Look, you only get one spine. You've got to take care of it. And at least at the time of this recording, we are doing a promotion for new patients. If you come in and you get a new patient exam, then included in the price of that new patient exam, we're going to give you a spinal hygiene kit. And that spinal hygiene kit is a value of $117, which is about the price of our new patient exam, and we'll give it to you. We'll give you the kit absolutely free with the new patient exam. So super cool deal. Again, that's at the time of this recording. So give us a call and see if that deal is still active if you're watching this later. You can always reach us at 281-664-2250 or send us an email at purelifefamilywellness at hotmail excuse me, at hotmail.com. All right. Sorry for all the frogs in my throat today. I don't know what's up with that. But thank you so much for your time. Thanks for being here and listening. And I hope you learned something in this series. Don't hesitate to reach out if you have any questions. And we're here to help. Thanks so much. Talk to you later.